Well, November is Lung Cancer Awareness Month. And did you know that lung cancer is one of the most common cancers and leading cause of death in both men and women right here in the U.S.? The Methodist Heart and Lung Institute Lung Center at Methodist Hospital is home to the latest, most advanced diagnostic, therapeutic, and management services for the treatment of lung disease and lung cancer in San Antonio. And joining us now with everything you need to know is Dr. Ali Abedi, pulmonologist with Methodist Hospital. Good afternoon.
Good afternoon, and thank you for having me.
Of course. Now, let's talk about what the signs and symptoms of lung cancer are and who is most at risk.
One of the interesting things about lung cancer is that early on, when the disease is still technically considered curable, it actually doesn't have a lot of symptoms. And that's one of the reasons why we see such a high burden of mortality with this disease. And so as the disease progresses and the tumor grows, it can start to exert some local effects in the lung that can eventually cause cough and coughing up of blood and lead to things like shortness of breath and so on. And as the disease progresses beyond there, it can create some systemic symptoms like weight loss and fatigue, and eventually symptoms related to other organs that it can metastasize to. But the important thing to note is that for those patients who are at risk for developing lung cancer, again, in those early stages of disease where curative treatments are possible, there may not be any symptoms at all.
So what can you tell us about the advanced diagnostic therapies at the Methodist Heart and Lung Institute Lung Center and how they're making lung disease care even better?
Well, part of our approach to managing lung cancer is first off figuring out how we can improve early detection. And one big arm of that approach has to do with taking those patients who are at risk for having lung cancer, so patients who have significant smoking history, more than about a pack per day of cigarettes for more than 15 years, patients who have smoking-related lung disease like COPD, emphysema, or those patients who have family history of lung cancer, especially in primary relatives, and making sure that we have a good organized approach to getting them into appropriate screening programs with yearly CT scans to see if we have any suspicious findings of lung cancer, and then providing them with a good mechanism to following up any of those results that may come up. And the second arm of our detection routine has to do with recognizing that until we get better at getting the word out on lung cancer screening, we need to make sure that any incidental findings that come up on imaging of the chest that was done for other reasons, which may be suspicious for lung cancer, are being recognized and enrolled in those lung cancer detection programs. And for that reason, we rely on technologies like natural language recognition software that basically mines through all of these different imaging modalities that are done at all the various imaging centers associated with Methodist Hospital for any suspicious findings that come up.
I know there are treatment options available for patients with lung cancer, right?
Yes, ma'am. And if we're able to catch lung cancer early enough, the gold standard for treatment is surgical resection of lung cancer, especially when the patient is healthy enough to undergo the surgery. And so at Methodist Lung Center, we've invested in a robotic bronchoscopy platform, which allows us, once we've detected a lung nodule, to be able to go through the normal airways of the lung with a GPS system essentially to try to get to this abnormal spot and biopsy it effectively early enough to get these patients to surgery for cure.
All right, Dr. Ali Abedi, thank you so much for all that information. You can take the health risk assessment to learn more about your risk for lung cancer and learn more about care at Methodist Hospital. Just visit sahealth.com/lung cancer. You can also give them a call at 210-575-LUNG. That's 210-575-5864.